Top 10 Essential Facts about the Coronavirus. There is a great deal of dread and disarray encompassing the crown infection called COVID-19, and it doesn't help that a few components of the media have been shooting data many consider dread-mongering. In any case, dread is the exact opposite thing anybody needs to spread, since even a worldwide pandemic doesn't mean it's the apocalypse. The data on the infection is constrained right now, as there should be a lot of study before it is completely comprehended. Meanwhile, data is power, so this rundown contains 10 things you should think about COVID-19 and how best to shield yourself from misguided judgments, mistaken assumptions, and by and large media lies about it. This data is only a glimpse of something larger, so stay up with the latest on episodes in your general vicinity from authentic sources, and everything ought to be fine. Here are the top 10 essential facts about the coronavirus. Number 1. What is a coronavirus? COVID-19 is a crown infection, which implies almost no to the vast majority who don't work in virology or immunology. A crown infection is a gathering of infections that contain warm-blooded creatures and winged animals. In people, they can cause respiratory tract contaminations, a large number of which can be treated with over-the-counter drug. The alleged normal cold is the consequence of a crown infection, and keeping in mind that most are surely known and once in a while in excess of a bother, some can be deadly. COVID-19 alludes to the episode of the illness, which is separated as Corona Infection Disease 2019. The infection itself additionally has a name, yet it's somewhat of a significant piece: Severe Acute Respiratory Syndrome Corona Infection 2, or SARS-CoV-2. Some portion of that abbreviation might be recognizable, seeing as the world previously experienced a comparable episode of SARS in 2003. The infections are connected, and it wouldn't be impossible to call this new episode SARS 2.0, however you likely won't hear any expert virologists state that in the media. In any case, COVID-19 is a crown infection, and it is spreading. However, that is not a reason to get excited, rather, it's a reason to plan and ensure ourselves similarly we do when it's cold and influenza season. Number 2. How COVID-19 came about and from where. It's well known that the virus was first seen in Wuhan, China, but it's not fully understood exactly where it originated. COVID-19 is likely a zoonotic virus, which means it can be transmitted between animals and people. This has led researchers to look for animals that might have originally carried the disease. There are a lot of similarities between COVID-19 and two bat-derived strains of beta coronavirus, which means they are likely related. Because the viruses share about 96% of the same genes, it was initially believed that bats were the source of the outbreak, which was pinpointed to the Wuhan seafood market, where exotic animals are sold. As time went on, and more research was conducted, Chinese researchers were able to determine that COVID-19 shared 99% of the same genetic information as a similar virus that infects pangolins. This suggested that pangolins may have been an intermediary host for the virus, but the research wasn't officially published, and much of the analysis remains unconfirmed. While determining the precise origin might help virologists better understand COVID-19, doing so isn't entirely necessary in combating the spread of the disease, now that it's been released into the human population. Number 3. How COVID-19 is transmitted. Since the primary day the world found out about the Wuhan corona infection, its dread spreading started to rise. How was it transmitted, and what should be possible to constrain its transmission? Individuals have consistently dreaded Ebola, yet that is far harder to get than something like a crown infection, and it's everything about what it taints and how it is transmitted. COVID-19 causes a respiratory disease, and it's through an individual's breath that it spreads the least demanding. There are two known methods by which the infection spreads: individual to individual and through contact with contaminated surfaces. In an individual-to-individual circumstance, the infection can be spread through close contact, which is commonly viewed as a separation of 6 feet. The manner in which an individual can pass it on is through respiratory beads, which are created when an individual hacks or sniffles. Covering one's mouth when this happens lightens the spread of the malady, and contaminated individuals should wear a face veil to decrease the danger of transmitting it to another person. Be that as it may, it would be ideal if you regard the Surgeon General's admonition and don't purchase a veil except if you need one. The other way it is spread is through a surface sullied with the infection. A ledge could have been in the pathway of a wheeze, which conveyed COVID-19 to its surface. Contacting that, and afterward contacting your mouth, nose, and perhaps the eyes can bring about disease. Number 4. How COVID-19 is detected or confirmed. Probably the greatest issue with identifying COVID-19 out of a patient is that it presents a lot of like the basic virus. To battle this, specialists over the globe have been scrambling to concoct an approach to test for the nearness of the infection, and this has brought about a few diverse testing strategies. Probably the most ideal approach is to check for the infection isn't to check whether you can discover the infection in an individual's body, it's to discover the antibodies the body produces to battle the disease. The tests that search for antibodies are called serological tests, and a firm in Singapore may have idealized methods for directing this sort of test to discover COVID-19. Immune response tests are presumably the quickest and least demanding method for recognizing the nearness of COVID-19, however it isn't the main way. There are tests as of now being utilized far and wide, which search for the infection's hereditary data in an individual's spit, mouth, nose, and rear end. These tests utilize the polymerase chain response (PCR) strategy, which is a procedure in atomic science that quickly creates billions of duplicates of DNA for study. While these tests can recognize the nearness of COVID-19, they can't distinguish individuals who were contaminated and at last freed from it. Number 5. Who is at risk? There is no known insusceptibility to COVID-19, which implies that everybody is in danger of getting and spreading the disease. That doesn't mean this is an ideal time to freeze, since you may get contaminated, doesn't mean you're going to fall over dead in a couple of hours. COVID-19 can be perilous, however, like most contaminations, certain segments of the populace are more in danger than others. Little youngsters, social insurance experts, the older, and individuals with an undermined insusceptible framework are the ones who are most in danger of getting truly sick from COVID-19. At the point when a solid grown-up gets the infection, there's a likelihood that they won't show any side effects whatsoever, and won't become ill. This is one reason the infection has figured out how to get away from the bounds of Wuhan, China, to contaminate the world. Contaminated individuals who are asymptomatic become obscure transporters, and in any event, when in any case solid grown-up shows side effects, they are regularly gentle and near to the basic virus. Number 6. What are the symptoms of COVID-19? Symptoms associated with COVID-19 that shouldn't scare anyone, but the last bit will be all about the more dangerous aspects of the disease. Don't be alarmed, as these are the worst-case symptoms that won't affect most people who are infected. The most common symptoms of COVID-19 are fever, coughing, and shortness of breath. These are the same symptoms most people get from the common cold, but they are the mildest possible symptoms a person can experience. For those who are under a greater deal of risk due to a compromised immune system, or meet the criteria previously mentioned, symptoms can become far more severe. COVID-19 can increase the chances of contracting pneumonia, it can cause multiple organ failure, and in some cases, it can result in death. These are the most severe cases, though all are of concern due to the ease by which it can be transmitted from person to person. Number 7. COVID-19 mortality concerns. Yes, COVID-19 can end a person's life, but that doesn't mean the world will end. The mortality rate for COVID-19 is estimated to be 2.3%, and while that number may seem low, it's not. If you compare the mortality rate of COVID-19 to something more common like the flu, it's considerably higher. The flu has a mortality rate of 0.1%, which sees an average of 1 death per 1,000 people. These numbers are determined via the case fatality rate, CFR, which compares the total number of infected patients with those who succumb from the disease. While COVID-19 is much higher than the flu, it presents as a mild infection in the vast majority of people who have had it. The majority of people who have died in China have been elderly, and studies of deaths from the virus show that the CFR jumps to 14.8% for people who are 80 and older, while those between the ages of 70 and 79 have a CFR of 8%. For people who were already critically ill when they came in contact with the virus, that number jumps to 49%, suggesting they are the most vulnerable members of the population. Number 8. Avoid getting infected. As a general rule, there are steps you can take to abstain from getting tainted, and risks are, you've been doing them from the beginning. Since COVID-19 is a coronavirus, which is passed similarly as a typical cold, the most ideal approach to shield from getting it is to wash your hands with cleanser and warm water, abstain from contacting your face in the wake of coming into contact with anything ordinarily utilized like door handles, and in the event that you need to head outside, Attempt to keep away from wiped out individuals. Chances are, you do the entirety of that as of now, so you don't need to let COVID-19 overturn your life or your daily practice. On the off chance that you have worries about ending up in a spot with a great deal of possibly contaminated individuals, you can abstain from making a trip and going to occasions with swarms, however that may not be vital. On the off chance that it causes you to feel better to wear a face cover, you can do as such, yet ensure you get the correct kind. The U.S. Food and Drug Administration perceives 4 off-the-rack N95 respirators, which might be successful in halting the spread of COVID-19, and they are 3M Particulate Respirator 8670F, 3M Particulate Respirator 8612F, Pasteur F550G Respirator, and the Pasteur A520G Respirator. These respirators are not reasonable for youngsters or men with facial hair. Number 9. COVID-19, HIV, and other conspiracy theories. One of the reasons there are so many conspiracy theories about viruses like COVID-19 is that few people truly understand it. Hopefully, this list will help with that, but there are people who hear a comment like, "This virus may use the packing mechanisms of other viruses such as HIV," and their imaginations tend to run wild. That finding was published by scientists at Nankai University, and it's true. The virus does have an HIV-like mutation, but that doesn't mean someone weaponized a form of HIV in a lab somewhere and released it upon the world, as some conspiracy theories have stated. These same mechanisms appear in many diseases as the result of natural mutations. That remark has everything to do with the means of fighting the spread of infection, and research like this helps push further research, which could hopefully lead to a cure or vaccine. You may have seen other conspiracy theories, including one about a new 5G wireless infrastructure being the cause of the disease, but this is so ridiculously false, it barely deserves mention. The most important thing to do when it comes to hearing these stories is, ask yourself if they make sense, see if they are published by reputable sources, and take a common-sense approach to anything you hear. Number 10. What to do if you think you're infected with COVID-19. The very first thing you need to do is, don't panic. Panicking doesn't help you or your loved ones, so you need to take care of yourself to ensure you don't spread the infection and make sure you get the proper care. If you develop a fever along with symptoms of respiratory illness, you should call your healthcare provider and ask for their advice. They will know the right questions to ask to help determine if you've got the common cold, or if you have something more serious. If you fear you truly did come in contact with someone infected with COVID-19 and are concerned you may have it as well, you need to get tested. Because you are leaving the house to get checked, be responsible, and keep your mouth and nose covered. This will keep you from passing the virus to other people, so if you have a respirator or a surgical mask you can use, do so. If not, you can use a scarf or similar article of clothing. Your local hospital may not yet be equipped with testing kits for COVID-19, so call your local public health department for information on the best place to go. In this global pandemic, please stay safe by following the guidelines streamed by your respective authorities and health officials. Don't forget to give us a thumbs up if you like this video. Subscribe and hit the bell button, so you won't miss out when we upload a new video. Also, check out our recipes and diet recommendations in the description below.